All eyes on yet another virus in the wake of a pandemic that brought the world to a standstill. Monkeypox is spreading quickly in parts of the world that aren't used to seeing it. Health officials are tracking more than 100 cases globally right now. Now, typically, the virus is only found in Africa, but here in the U.S., at least one confirmed case in the state of Massachusetts, a man who returned from a trip to Canada, and we have just learned that Florida's health department is now looking into a second presumptive case, while officials look into probable cases also in Utah and New York as well. President Biden said today the virus does not rise to the level of concern sparked by COVID-19. Dr. Monica Gandhi is with us tonight from the University of California, San Francisco. She specializes in infectious diseases. She joins me now. Dr. Gandhi, thank you for being here. One thing that I've been thinking about all day is at the beginning of COVID, everyone was saying, calm down, this isn't going to be a big deal, don't freak out, it's going to go away, we're safe in the United States, and it seems like that's what everyone is saying about monkeypox now. Do you think we should be concerned?
I really don't, but they are completely different viruses. So COVID-19 is an RNA virus that spreads very quickly by, unfortunately, what's called airborne transmission. This is a very known entity. Monkeypox has been around or was identified in 1958, so we know this virus. It is a DNA virus called an orthopox virus. It's in the same family as smallpox, but it causes less severe disease. And you're right, it tends to cause disease in Central and West Africa, and it has to do with animal exposure, mostly rats or rodents. But this is an outbreak that's occurring in what's called, quote, non-endemic areas that we don't see, but they're very linked. All these cases are linked. There is this, right now it seems to be occurring more in gay men. There's some big raves that happen in Belgium and Madrid, and there's some links to those particular events. And then, you know how travel happens and people can be around each other, but it's very hard to get. It's so hard to get that there was a case of a travel case in 2021, and it was a patient from Nigeria. They took 200 contacts around him in a plane and no one got it.
Okay, so it's difficult to get. That's at least somewhat reassuring. I've read that it's not technically sexually transmitted, but that it could almost like live on bed sheets. So if you slept in someone's bed that had monkeypox and it was on the sheets, you could almost get it just from being in the same bed even a day later.
So that's more consistent with the animal-to-animal exposure. It's true that you can get it from cages and animals. However, I think the main mechanism here is very close respiratory contact. It is right now being associated with sexual activity, but you're absolutely right. It doesn't look like it's sexually transmitted. We've never seen that before, but it is probably the close respiratory contact that occurs when sexual activity occurs. That's why you're not usually in a plane, you know, in such close contact with someone as you are during an intimate encounter like that. And the other thing about it is it looks so distinctive. Remember COVID-19, right? It looked like so many things. It looked like influenza or RSV. It was respiratory. This was so distinctive. It's a very clear rash that is actually first kind of becomes pustular, and also lymph nodes, big lymph nodes, and then fever. It's so distinctive, people can be isolated and contact traced, and that's why we think we can contain it.
Okay, that's good that you clarify that it's distinctive. I promised one of my Twitter followers I would ask you this. She sent me photos of shingles, and then she sent me photos of monkeypox, and her concern was that they look alike, and that is it possible that doctors who are not familiar with monkeypox here in the United States are really going to be able to identify it?
That's a very good question. Number one, doctors are on high alert, so they're on alert for it. It's right now in a particular epidemiologic group, which is gay men. And shingles is actually not specific to gay men. And just right now, monkeypox is. And it's different. It does go to vesicles, which is what zoster or shingles looks like. But shingles is in a particular, what is called dermatome, a particular distribution. These get more pustular. They almost look like blisters. They really look like blisters. That's so distinctive and weird. That's actually what smallpox used to look like. So more blistery with pus, looks like pus is in them. That's the difference. Then when they crust over, they can look the same. This also comes with fever and lymph nodes, those are not features of shingles. And we are on high alert, like you're putting us on high alert as you should. The news has told us to be be on high alert. Both patients and doctors are on high alert in this particular community. And I really do think we'll be able to contain it.
Yeah, when you describe those symptoms, definitely not something any of us would want. 21-day incubation period for monkeypox. That's pretty long, isn't it?
Yes, though it's usually 7 to 14 days. So I'm not sure about the 21-day information. There are two different clades. One is what's called a Congo Basin clade, and one's West Africa clade. And this looks like it's the more mild strain, which is West Africa, and it has a shorter incubation period. So hoping that if it's more mild, that again, we haven't heard reports of people getting very sick. It's much less mild than smallpox. Think of smallpox as just terrible. Monkeypox is a milder version.
Okay, so we'll try to stay calm for now. I think people are worried coming out of COVID, obviously, which is understandable. Dr. Gandhi.
And their treatment.
Okay, we'll try to stay calm.
Okay, try to stay calm. Thank you. Thank you.
All right.
Thanks for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.